So the 12-week ultrasound, this is typically coupled with something called Nuchal Translucency scan. And this is an ultrasound, again, done around 12 weeks of gestation that helps to detect a baby's risk for Down syndrome and other chromosomal abnormalities like trisomy 13 and 18, which can be serious, more rare, but serious conditions. It's also a screening that helps to assess a baby's risk for spina bifida. It can more accurately date a pregnancy. So like for me, for example, based on my dates, like when I went for this scan, I should have been 13 weeks, but when they did the measurements, they actually found out that I was closer to like 12 weeks. So that can get you a more accurate idea of your due date. It can be an early way to detect like certain structural abnormalities in the baby. It helps to assess their heartbeat. It can reveal if there are multiple fetuses. And it also allows the specialist to evaluate your fallopian tubes, your uterus, and your placenta. They can look at if you have a tilted uterus or if you have placenta previa, which means that the placenta is partially or completely covering the cervix, which can be serious. It's certainly something they'd want to monitor because sometimes it can move, but if it stays over your cervix, that's something really important for the doctor to know. Okay, so during the scan, there's kind of like two measurements that the specialist administering the ultrasound will look for to, again, determine the baby's risk for Downs, for the other chromosomal abnormalities. So one thing they do is they evaluate the fluid beneath the skin of the baby at the back of the head and the neck. And extra fluid in this area could indicate an issue. Every now and then there's extra fluid and it doesn't end up being a sign of anything. Sometimes that extra fluid goes away by 18 weeks gestation. But if there is that extra fluid, it could be a signal that the mom should get additional testing or should consider additional testing. The doctor will also measure the baby from the head to the bottom, and this measurement can also give them helpful information during this assessment. And it's really important to note that this scan does not diagnose anything. It does not diagnose anything. It just provides insight, again, into a baby's risk. And it can help to inform if the mom wants to get more extensive testing like amniocentesis, for example. And this test is usually done in conjunction with the NIPT test that I will cover in another video. And this is a blood test that looks at the baby's risk for like Downs, trisomy 13, 18, and it's also a test that can determine baby's sex, so that's exciting. And it's also done around like 12 weeks of gestation. If you have any questions about this or anything else at all, let me know in the comments below.